Hello, welcome back to the News Hour on TRT World. It was 2018. The World Health Organization came up with a short list of diseases. Basically, it was looking at how best to plan for a pandemic of the future and, most importantly, reduce the time between the emergence of a disease and finding a vaccine. For any illness with the potential to kill millions, of course, preparation is key. And a panel of experts knew that in the future, an as yet unknown disease could cause huge damage to humanity. The mystery that they said we need to prepare for, they called it Disease X. An opinion is divided on whether the novel coronavirus is Disease X. The WHO itself said 2 weeks ago that SARS-CoV-2, it believes, is not the big one. In a moment, we're going to have some analysis. But first, here's my colleague Ali Jan Ayanlar with a look back at some of the deadliest global illnesses to have hit the world over the past 100 years.
Well, COVID-19 has established itself as the deadliest as well as fastest moving pandemic since 1918. So let's start off with the 1918 flu, also sometimes called the Spanish flu. It came in two waves, and the numbers are just staggering. It's believed that as many as 500 million people were infected, with approximately 50 million deaths worldwide. All right, moving on. You know, most of the pandemics in the last 2 centuries have either been caused by an influenza virus or a coronavirus, but this next one is neither. It's a polio virus. The pandemic, the epidemic, started around the same time as the Spanish flu, but lasted much longer. The disease mainly affects children and sometimes leaves survivors with permanent disabilities. In 1954, the Salk vaccine was developed, and the last case of polio in the United States was reported in 1979. The next one I want to talk to you about is the human immunodeficiency virus, or better known as HIV, and the disease it causes, AIDS. An estimated 35 million people have died since it was first identified, and for decades, the disease had no known cure, but medication developed in the 1990s now allows people to experience a somewhat normal lifespan with regular treatment. Even more encouraging, as of 2020, 2 people have actually been cured of HIV. The next disease I want to mention was first identified back in 1976, and since then there have been numerous outbreaks, all of them on the African continent. Ebola. The deadliest Ebola outbreak ravaged the western part of the continent between 2014 and 2016, with nearly 30,000 reported cases and more than 11,000 deaths. So about a 50% mortality rate. There is no cure for Ebola, although efforts at finding a vaccine are ongoing. Well, outbreaks of infectious diseases manifest in many different ways. Some, like malaria, continue to spread widely for centuries, even in the face of effective means of control. Others, like this next one, arise quickly and then are gone in several months. The severe acute respiratory syndrome, or SARS, is an example of an outbreak that never really reached that pandemic status. At its peak, there were about 20 deaths every day and a total of about 700 people dying as a result of it.
Ali Jan, thank you very much indeed. Let's go to the UK and speak to the senior clinical lecturer at the University of Exeter's Medical School. You know him well by now. Dr Barak Pancania joins us. Doctor, thanks so much for your time. Is it a given that the world is going to experience more pandemics like COVID-19 in the future?
Oh, it's absolutely a given, and we should prepare for it. And thus far, it has always worried me that whilst we are very focused on the pandemic, the SARS-CoV-2 pandemic, we need to invest and prepare for unknown pandemics. And the best way to prepare is to work on a prevention principle. If you work on prevention, it costs you billions of pounds, but you prevent it. If you refuse to work on prevention, it will cost you trillions upon trillions upon trillions of pounds, and you might lose control. So prevention is better to spend that money on prevention.
The WHO is encouraging everybody to learn from COVID-19 for what may be coming in the future. One of the things that strikes me is that how much have we actually learned? Because when you look back at the Spanish flu over 100 years ago, in the Spanish flu, the 2 most important tools that humanity had then were masks and ventilation. And we're still at a moment in time where some countries, people are not necessarily wearing masks as often as they should. So what do we need to learn from what's happening now to prepare for the future?
Well, there's 2 arms. One is after the event and one is before the event. What we really need to learn is how to prevent it ever arising in the first instance. And then you won't have to wear your masks and you won't have to do anything. On the other hand, if it emerges, then you have to go into what we call infection control, outbreak control measures. And the outbreak control measures are always difficult and more expensive and hard to implement. So what would I advise is stop messing around with the environment. So once human beings go into the animal environment, we get into unknown territory. You may get the emergence of unusual, unexpected viruses because we've gone into animal territory that we're not supposed to go into.
Yeah, that's very interesting because so many people are saying that as human behavior destroys wildlife's habitat, the animals are living closer to human beings, and that's going to help the spread. Okay, what about the rollout of vaccinations? What does what's happening now teach us for the future? And I don't know if you can explain this to me, and it may be too simple, and I'm not understanding something. If there are formulae that already exist for vaccines that may be made by whoever, by Pfizer, Oxford, Moderna, whoever, why can't those formulae be given to every laboratory that can make a vaccine in the world, and they just manufacture them and we vaccinate the whole world in 1 year?
I totally agree with you, and I'm at one with you. And I have been advocating exactly this, which is I know that there are commercial interests and people need to make money, or pharmaceutical companies need to make money. I have advised, and I advise still again, is on license, on royalty payments, set up additional plants in rich, affluent countries like the United Kingdom, European Union, America, and manufacture at scale more vaccines. Because the line is as simple as this: no one is well until everyone is well. So unless and until we immunize Africa, South America, Asia, the poorer countries properly, the Western countries will never be safe from these outbreaks. So we should immunize our people nationally, but we should also aim at immunizing internationally. How do you do that? Exactly as you said, enable additional manufacture of these vaccines so that we can immunize Africa, South America, elsewhere at fast pace.
Dr. Barak Pancania, as always, really appreciate it. Thank you so much indeed. Take care.